My name is Martika Swaby. I'm the founder of Benevolent Health, and I'm a psychotherapist by background. I've worked in a number of different healthcare systems and most recently in the corporate space. And I'll let Christine introduce herself.
Awesome. So hi, everyone. My name is Christine Francois. I live in the Republic of Trinidad and Tobago. I'm part of the Benevolent Health team. I'm a former banker and corporate communications manager, and really have a passion for people and animals, and actually have been looking at how we can incorporate animal therapy as well in terms of helping individuals with their health and well-being.
So just to set the scene then, in terms of Benevolent Health, I think the reason I founded Benevolent Health was really to shift the narrative away from illness and into more of a wellness conversation, because we all know there is no health without mental health. And I think everybody on this call today is probably really on board of shifting that narrative. And I think that the backdrop that we're in now with COVID and Brexit, huge campaigns around inequalities like Black Lives Matter has really pushed the better mental health conversation to the top of everybody's agenda, particularly in communities and in the corporate space. So when I started Benevolent Health 6 years ago, it was quite a challenge to kind of focus on the wellness conversations and think about relationships, nutrition, exercise, sleep, connection, how important these things were for our wellness and our mental health, and that actually it should be on every corporate leader's agenda, as well as individuals' agendas. And I think that COVID's really helped us to accelerate these conversations much quicker. So really how we're making it bespoke and human is we're taking our model, which is in 3 tiers. So providing engagement and awareness through our wellbeing toolkits, providing tailored support to managers with bespoke content around targeting wellbeing interventions, and then the one-to-one coaching or mentoring. And I think that it's important to think about mental health in a diverse way, because actually, you know, we're not this homogenous group of people, and everybody relates to wellness in a different way. So for us, the digital mental health solutions, I think, really bring to life and encourage engagement and connection around wellness, and not just on, you know, mental health awareness days or specific days, but keeping this relevant throughout the year, because it's something that needs to be on all of our agendas all the time. I think from a digital perspective, just having asynchronous platforms or things that don't have a live element, don't have a people element, is really difficult to connect with. And what we know from the pandemic is that people really have missed connection. And so I think there's real opportunities, particularly one-to-one through our coaching programs, but also in small groups, to really connect with people who are experiencing similar issues, who look like the audience that we're trying to connect with, because I think representation really matters when it comes to diversity in our mental health. And just linking back to some of the inequalities and deprivation that Professor Collins talked about in terms of citizenship empowerment and really keeping people in the kind of wellness space. We know that there's huge inequalities across countries, across societies, particularly in the UK. And I really feel that this is closely linked to some of the challenges around work-life balance and this amalgamation of the kind of digital and real world, if you like, and keeping some of those boundaries separate. So we've heard narratives around burnout increasing through the pandemic, that people are presenting with more complex mental health issues, and just being more open about feeling stressed, anxiety, anxious and depressed. And actually that's okay, that we want to have those conversations, and that we want to have those conversations in the workplace. So for us, having asynchronous platforms has been important in being able to add value, particularly in organisations. People are busy, they need to be able to engage engage with content when they like. But the most important thing is that connection and building communities. And I think having an online and offline world is really important in the future of citizenship empowerment. And just finally, and Christine's going to build on this a bit more, I think one of the biggest challenges faced by organisations, by communities, by big healthcare systems is actually letting people know that their services exist. And I think one of the challenges is people often seek help when they have a problem, and it's not thought about so much in the preventative or wellness space. And so I think there's a really real opportunity for employers and for communities to start having these conversations much earlier. And so one of the impacts of the projects that we've worked on with CEmPaC is just being able to get out into the public domain more information about the programmes offered. So in this campaign, we reached nearly 9,000, just over 9,000 people, and 600 people went to the programme that CEmPaC offer around wellness. And our primary focus really was not to create anything new, but just to promote what already exists and to make people aware that, you know, these programs, this support exists. And some of that was around creating live conversations around course content like relationships, nutrition, sleep, and building that community. So it's really important to be able to keep the conversations live and going if we want to empower our citizens. So over to you, Christine.
Fabulous. So what we attempted to do was to help individuals feel a different way about their healthcare and about the collaborations that we were hoping that they would participate in. And so we all knew, and Dr. Collins really laid it on the table this morning, what individuals are experiencing today is a challenge with their mental wellness. They're inundated with negative messaging 24/7. And so sometimes it feels as if you want to close in. We are encouraging them to be more open to the possibilities of partnering for their own wellness. And so our program really encouraged individuals. We had engaging conversation, and we did help CEmPaC with their messaging and to get them shown in a particular way. And we were able also to launch a Facebook page that actually engendered that openness and that interactivity and so on. The story that we shared was really, we identified, and CEmPaC did identify the target group. This target group looks very much like me, women in their 50s and beyond. What we were trying to do with them, and what we believe we did, was get them to see themselves in a more positive way, looking towards the future with enthusiasm, and in this, showing them that they could actually plan their own healthcare, that they can actually incorporate all of these alternative methods of looking at health, so that they felt positive. They were able to see themselves as taking an active part in their own well-being. And this was very exciting for us, and I'm sure for those who participated in the program as well. So it's important, as we share with these women, these individuals, that they feel more energized, they feel positive. I know it's very hard in this particular environment, but what we need to do is we're able to help individuals see that in spite of the negativity, there's so much we can do as we partner together, not just amongst ourselves and communities, but as we partner with our healthcare providers, so that we can all benefit. And we actually not just help ourselves, but the next generation. You know, in one of our talks on rest and sleep, we looked at the challenges of individuals being made to feel that sleep and rest was not really the thing to do. And so many times we see that there are their bosses who challenge their team members to work through long hours, not to take that rest. And that is something that we're trying, that's a trend that we are attempting to break here. Understanding as well that bosses are people too. Every single person in the spectrum going through their own challenges as we navigate this brand new world post-pandemic, or should I say, as we're still within the pandemic era. So what we also did was to make sure that people understood that we have to take a new approach to time management, a new approach to supporting each other in a collaborative way so that we actually feel more rested. And of course, as one close friend of mine who's a functional medicine practitioner said, the best thing that you can do for your body after breathing is sleep and resting. Just be you. What we are seeing as well is we are tapping into diversity. We are tapping into all of these new holistic methods of wellness. We're even more focused post-pandemic in really taking the time out to focus on things that help us to navigate those challenging times, whether or not it's taking time out with friends, whether or not it's taking the time for spa days and being the person that you were meant to be. It means that in this new paradigm of healthcare, we are encouraging individuals and the demographic for sure to celebrate in a very real way their connection, their humanness, and to reach out not just to each other, as I said before, but to their healthcare providers as partners, and being able to make relevant decisions in their own healthcare and looking at all of the options so that in the long run, as Dr. Collins said, we can literally turn the tide of the over-medication of the populations. Thank you.
Thanks, Christine. So, I mean, just to sum up, I think just want to kind of go back to asynchronous platforms a bit, and what I'm talking about in asynchronous platforms is, you know, Facebook groups, Slack. Organizations sometimes have internal structures, and this kind of mix between being able to access things digitally and being able to access communities and real people and have conversations. And so I think from an empowerment perspective, particularly in hybrid, and you know, we have gone into these very digital worlds, that actually we need a bit of both, and we need to be able to provide support in a tailored way that means something to the individual. So, you know, how do we do it at scale and how do we make it individual? I think for Benevolent Health, really bringing this together has enabled us to, you know, work with a global community. So, and thank you for listening.